Best practices pre-infusion, I think, are really providing education to the patient and their family as to what to expect through the journey, what their first appointment entails, what each subsequent step along the journey is. And that could include anything from drug education to education about apheresis, logistical information, where to go at the cancer center, what time to be there, who they can have with them. And there's lots of, resources out there that we can provide patients with as far as education goes. And providing ongoing support for the patient and the family. Like I said before, this is very anxiety producing for them because they've already failed multiple therapies and they're worried that this is going to work. So I think providing education and providing resources to them, letting them know that they're validating their feelings and letting them know that what they're experiencing, all of our patients experience. And we understand that because they've been through so much, and providing them with the resources that we have available for them. And some of them may be in-person resources. Some of them may be online resources. It really depends. And I think assessing the patient and the family unit as to what works best for them and what their learning style is really important. And that goes for both pre and post CAR T-cell infusion. And then post-CAR T-cell infusion, I think the big thing is to reinforce what the toxicities of CAR T-cell therapy is, and that it, can happen immediately after the CAR T-cell infusion, but it may happen up into the 30-day period post-infusion, which is why we like to keep them close to the cancer center, and then explain and provide education, give them a handout, give them a number to call in off hours as to what signs and symptoms they should report to us. And I always tell patients, call us. If there's any doubt, call us. I would rather have you call us and err on the side of caution than not call us at all and have a bigger problem to handle. The overall compliance of patients is really important because we're not going to get them through this journey if they don't, comply with the treatment plan and the schedule. So care coordination is extremely important, that many of our patients are coming from a distance. They may still be trying to work while they're, getting ready for the CAR T-cell infusion or getting ready for the apheresis process. So, coordination is really important, trying to get as much done on one day as possible to make it easy for them. If they're going to travel 2 hours to the cancer center, if we can get most of their appointments in one day, that may be a big day for them and it may be tiring. But overall, I think it's better for them because they're done in one day, and then they have other days where they're not making subsequent trips back and forth till they really have to come in, say, for their apheresis or for their infusion. So giving them that period of time that will help their quality of life, get them to spend time with their family, their children, tie up loose ends before they come in for the CAR T-cell infusion, I think is really important. It's very stressful for patients, especially if they're, from a small town and aren't familiar with the big city, to have to come into a big city where they don't know anybody or where to go or how to get around, and have to make multiple appointments on different days at the cancer center. And, that involves some financial concerns too, is, with the cost of gas, the cost of tolls, parking and everything, that, also has a huge impact on patients. So if we can consolidate things and make it easier for them, it really does help them.